We have 5 speakers here today to talk about public healthcare issues, and it's good that you guys came out today so we can actually discuss as a community how federal funding is going to affect us and the provincial government, and how we can work together to get our sacred healthcare in effect for everyone. Because although we have public healthcare right now, it's an asset, but if we lose that, how will we be impacted? How does that affect our daily lives? Good friend of mine, Dr. Ritika Goel. She's a family physician who completed her medical school training at McMaster University and her family medicine residency at St. Michael's Hospital through the University of Toronto. Her interests lie in the health and well-being of marginalized communities, including those in her public Toronto and the City of Toronto, rural Canada, as well as internationally. She believes that health is a human right and should be made accessible to all. Ritika is currently a board member of Canadian Doctors and Medicare and an organizer with Health for All. Please welcome me in bringing up Dr. Ritika to the stage.
Thank you so much for that introduction. So I'm Ritika. You got to hear a little bit about me. What the bio doesn't include is that I'm Indian. So I was born in India, my family left India when I was 6, and then I grew up in East Africa, and my family came here when I was 13. So I've had a chance, to see what the healthcare systems are like in other countries. I've grown up in countries that don't have a public healthcare system, and I think many people in this crowd might have that experience of knowing what it's like to live in a low-income country where there isn't free public healthcare and what that means. So, I had a chance to experience those systems, and I've also worked in some of those systems as well. And I've studied the systems, and it's interesting. As a family doctor, I'm at the front line of healthcare. So when we talk about all these policies, it's very similar to me as it is for the patient. You are also at the front line of healthcare. Politicians talk about policies, but we have to see what actually happens on the ground. So for me, as a family doctor, I'm very worried about the direction that our current government is taking healthcare in. Our current government is not interested in maintaining our public healthcare system. If anything, they're very interested in privatizing and in creating a two-tier healthcare system. So we'll talk a little bit about what that means. So as a family doctor, wanting to do my job, wanting to help people, wanting to work with people to keep them healthy, to make them healthy when they're sick, there's certain types of healthcare systems that help me do my job, and there's certain types of healthcare systems that make it really hard for me to do my job. All the systems, when you look at around the world in high-income countries, except for the US, that have healthcare systems that work for the people, those are the ones where people have decided to pool all of their money and have a publicly funded healthcare system. And those are the systems that that make it easy for doctors and make it easy for patients. I have a lot of colleagues that work in the States, and they told me that they spend hours in their day fighting with insurance companies. So in Canada, I hope this is your experience, you go to see your doctor if you're feeling sick, you talk to your doctor about what the problem is, and your doctor recommends some tests or some treatment, and then you go through with those tests and you get that treatment. And usually you don't have to pay anything between all of that. That's not how it happens in the States. In the States, you might go to your doctor and you might discuss what tests you need and what treatment you need. But then there's somebody that comes in the middle, and that's the health insurance company. So in the States, the doctors have to convince the health insurance companies that what their advice is actually valid and that the patient really needs that thing that they're trying to get them. And that's because the health insurance company is not really interested in providing healthcare to the patient. An insurance company is exactly that. So if you think about car insurance, everybody, most people in this room, I assume, have car insurance. When you go to get car insurance, they want to know your driving record, right? They want to know how high risk is this person to have an accident. They want to know how old you are, because certain people in certain age groups are more likely to have an accident. They want to know, have you ever had an accident before? Because that will tell them maybe you'll have an accident again. If we were to set up an insurance system for healthcare, it would be exactly the same thing. So if you are elderly, they would say, well, you're at a higher risk for medical problems. Or if you've had medical problems, let's say you've had a heart attack, they would say, well, you're at higher risk for having another heart attack. Or let's say you just have a family history of heart disease, which lots of Indian and Sri Lankan people have, right? If you just have a family history of heart disease, you get punished for that. And they say, well, you should pay more, even though you have no control over that. And the reason is because at the end of the day, they are not interested in providing health care. They're actually interested in preventing people from accessing it if you're a for-profit insurance company. So we're saying that that's not the solution. There are some problems with our system. I'm not here to say that the system is perfect. There are wait times, and nobody wants to wait when they feel sick. There's wait times for certain surgeries, for certain specialist appointments, and people would say, well, why don't we privatize the system? Because then the people who are rich can afford to just jump ahead of the line. And when they jump ahead of the line, we'll shorten the line for everybody else. But that's not really how it works. So if you think about it, if I'm sitting in my clinic and I have 10 people in the waiting room, and they're sitting there in order to see me based on how much they need me, and maybe the person at the front is having some chest pain that's really, really serious, they need to see me right away. And then the person at the back, the 10th person, just has a cold. They don't really need to see me right away, but they'll see me eventually. But let's say that 10th person is able to pay to jump in front of that line. And they decide, I'm going to pay out of my pocket, or I'm going to purchase private insurance, and I'm going to jump at the front of this line. What happens to the rest of those 9 people? This doesn't create a new system for them. It just changes the order of the line. So the people who are the sickest end up moving to the back, and the people that can afford it move to the front. That's not the type of system that we want. And the reason that that happens is because we only have a certain number of doctors. We only have a certain number of nurses. We only have a certain number of all the people that make the healthcare system work. So if you set up a 2-tier system with 2 lines, you're just reordering the line based on the people who can pay. And the people who will be able to pay, this is not you or me, right? Healthcare is really expensive. One night in a hospital is about $1,000. That's not something that most people can afford to pay. So probably what we would end up doing is purchasing private insurance. But then you would have the same problem that I mentioned before, that private insurance companies are interested in denying you health care. They're interested in figuring out who's at risk. They're not interested in actually providing that service. So in Canada, there used to be a similar system to what's in the States now, or a similar system to even in what's in India. The system basically where if you have money, you can go to the doctor, and if you don't have money, you either hope for charity or you don't go. You just wait, and maybe you get worse, and maybe you even die. So in Canada, we used to have that type of system, and then in the 60s and 70s, they decided, hey, what if we put all of our money together, and we do it in a fair way through taxes, so that the people that make the most pay the most, and the people that make the least pay the least. And then all together, we can take that money, and we can create a system that wants to work for everybody. And that's exactly what we did. And when you look at the difference between the Canadian system and the American system, once we put in place public health care, our costs actually went down. So now we have a system that's more fair, but it's actually even more cost effective. So how does that make any sense? We always hear we don't have enough money for health care, we don't have enough money for services, so we have to cut those things. But the reality is actually that it's a lot more administratively efficient to have a public system. And I'll explain why. So my colleagues in the US tell me, because they have to spend so much time fighting with those insurance companies, they need extra staff to be able to do that.